Hi, my name is Amanda Monahan, and I'm going to go over the ethical dilemma that was presented in class regarding a 72-year-old woman who was admitted because of having a cerebral hemorrhage, and she was left with severe brain damage and ventilator dependent. After reading the story, you will also be able to read in my paper that as unfortunate of a situation this is, and many of us hope to never be in this situation, I do think that the woman should be taken off of the ventilator. If you read word for word, as noted in the paper that I wrote, what the actual living will said and the actual words of the physician are identical in that the woman would like to not be placed on any sort of artificial life support, and that's essentially the only way that she's going to continue to live. As a family, the last thing that anybody would ever want is to have to make that decision to take your loved one off of any form of life support and see them essentially pass away. However, in this story, the husband is definitely grieving, which is something that will have to take place regardless. And it sounds as though the children understand the situation and the fact that the mother would not have wanted to continue living on life support and would like to be taken off the ventilator. Essentially, I think the husband really would agree if someone would sit down with him and talk with him. It sounds as though the treatment team had given him about a week to try and come to terms with the situation, and he doesn't seem to be changing his mind. I do think that if he was approached in the right way with his children and just kind of explained that this is a very difficult situation and it's not going to be easy. However, if they were to talk about the quality of life that she would have from there, or the lack of, being that she never would, chances are, wake up or have any sort of function whatsoever and would essentially be a vegetable. I think if it were kind of laid out to him and just expressed how they understand how it's difficult, however, the woman would not want to live like that, and essentially she had said that in her living will. I think that he would come to terms and hopefully would decide that, yes, this is the right thing to do. As hard as it is, it's what she would have wanted. However, unfortunately, if he did not, I do think that it is the professional's responsibility to make the decision to take her off of the ventilator, which essentially would probably lead to her death. I think it's important to follow what the living will would say, regardless of if her husband thinks that she would have meant different in this sort of situation, especially if the children are saying that they don't agree. I think it's important to follow people's wishes. I know I would, and I'm guessing most people make those living wills and those decisions because that's what they would like to happen. And they don't want their family to have to make that decision and think, oh goodness, I have to take them off this life support, when the person has already made the decision for their family. So the family doesn't feel like it's their fault and that they have to do this. So I do think that essentially the wife would have wanted to be taken off, and the medical professionals need to make the decision to take her off it. Ethically and morally, it's just the right thing to do if it was stated in the living will, as difficult as it may be for any family member. They need to do that. I do think it would be important in the situation to kind of put yourself in the shoes of the other people involved in making any sort of ethical decisions, especially in the medical profession. I think it would be important to look at it from the woman's aspect and look at it from the husband's aspect and try and get the husband to see the woman's aspect of things. I think we're better able to understand each other and their positions and thoughts and feelings if we try and put ourselves in their shoes. Not that we necessarily can feel exactly what they're feeling, but I do feel that we'd have a better sense of relating. I do also think it's important to remember there is two sides to every story. So it's always important to look at all points of view and try and just step back from the situation that you're in and really analyze it and see what's going on. Ethics, I think, is something that is ever changing, just like the world we live in. As different cultures and different trends happen, I think ethics kind of change with those. And I think it's important to be aware of what's going on and to kind of see what culture has brought, as opposed to being stuck in this is what's ethically right, when that may have changed from what was ethically right 20 years ago. Overall, I think this was a really good situation to present, to assess, and as difficult as it is, I think it was good to really look through and try and figure out all points of view. And if I were the medical administrator who would have to make that decision, I think it would be difficult, but I think it was good to have to try and look at all aspects and all sides and ultimately make a decision that may not be the easiest decision to make. So thank you. Hope you enjoyed my paper.